So the purpose of this study was to evaluate the degree to which routinely collected electronic health record usage measures could be used to predict physician well-being outcomes, and specifically looking at professional burnout in this case. I'm Daniel Tofik, and on behalf of my co-authors, I'm very pleased to present to you our article entitled Predicting Primary Care Physician Burnout from Electronic Health Record Use Measures, which will appear in the September 2024 issue of Mayo Clinic Proceedings. So this was a study that was conducted among primary care attending physicians in both an academic and community medical setting affiliated with Stanford University. And the study period was from early 2019 through late 2020. So this study was actually designed in the pre-COVID period, and then actually the study period sort of spanned the kind of pre-COVID period and then the early COVID response. This wasn't something that we anticipated when we set out and when we designed the study. If anything, it may have been helpful in trying to tease out some of these relationships, because COVID was an exogenous shock on the system and really affected how people manage their workflow, and especially among primary care physicians, resulted in some very rapid changes to their practice, which we thought may have helped us identify some of these predictive characteristics, but unfortunately didn't seem to show much of a difference. We extracted electronic health record usage measures using a combination of vendor-derived measures for our EHR. That vendor-derived set of measures is called Signal, plus some additional measures that we calculated on our own, reflective of patient workload and experiences with patients. From these extracted EHR usage measures, we collated a set of 191 candidate features and used those to train a prediction model predicting the responses from a routinely administered burnout survey that was applied to all of these physicians of interest. We had 396 surveys that were completed by 233 unique physicians across the 2 years of the study period. Each physician was invited up to 2 times. Most of them were invited 2 times, and most of them did respond 2 times to the survey. So we had kind of longitudinal following of those physicians. There were some physicians who were invited twice but only responded 1 time or the other time, and then there were also other physicians who either joined the institution halfway through the study period or left halfway through, and so were only invited in 1 year or the other. And what we found was that even with this large amount of candidate EHR usage measures, we weren't able to reliably predict what individual survey responses would be. The best performing model that we had was using a gradient boosted classifier classification model. However, this did not give us areas under the receiver operating characteristic curve that were reliably even above 0.5, which would be what we would expect for a naive model, or one that would be performing random guessing. Even with several other prediction modeling approaches, there was very little discrimination that we were able to achieve for predicting burnout scores. However, what we did find is that when we aggregated by average clinic score, that we were able to somewhat reliably identify those clinics that on average had higher burnout scores than other clinics. And so when we classified each clinic as either standard risk, meaning they were in the lower 75% of burnout scores, versus high risk if they're in the top quarter of burnout scores on average, what we found is that our aggregated prediction model was able to predict being in that top quartile with 56% sensitivity, but with 85% specificity. And so Overall, what we found in this study is that among these primary care physicians, our routinely collected EHR usage measures were not able to very reliably predict individual level burnout scores. However, they were able to give us some hints as to those clinics which were struggling the most or had the highest average burnout scores, which could then be targeted for directed interventions to try to improve the well-being of the physicians at those clinics. I'd invite you to read the article to see more details of the study and what our findings were.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.